If you lighten the skin enough, you damage the surface. You make it weaker so that it doesn't protect you as it should from the harmful rays of the sun, which then long term puts you at risk of getting a skin cancer. So the girl that wants to be a surgeon, the truth is you can be anything you want to be if you put your mind to it. So do not let someone's negative thoughts or expectations affect how you live your life. Be what you want to be.
Hello everyone, and welcome to this episode of The Journey. They say beauty is not just on the facial, on outwards, but it's a light in the heart. A poet, Khalil Graham, said that. Today, I'm welcoming my dear friend, Dr. Joy Odili, who is a plastic and reconstructive surgeon who works at and consults at St. George's University Hospital, London. Welcome.
Thank you for having me.
So Joy, I met a couple of years ago, I think it was maybe 2026, 27. She was speaking at an event and we met, and she's been a client.
2016.
Well, 2016, right? And she's been a client and turned friend ever since. Joy is someone who works in a very male-dominated industry, and she's very particular and very forward in mentoring young women, especially women of color in this field. There's a misconception about plastic surgery, and when we hear it, we just go, So Joy is here to break that myth and tell us a bit more about her field and her industry, where she mixes medical experience and expertise with artistry in her field. Welcome again, Joy.
Thank you.
So tell us, how and when did you decide to become a plastic surgeon?
So I decided to become a plastic surgeon after my very first surgical job after medical school.
Okay.
I was always going to be a surgeon. It was a question of what specialty, what subspecialty. And I realized that it's the only specialty that allows you to operate on anyone, male or female, young or old, inside or out, from head to toe.
Really?
It's the only specialty.
Really? How come?
Because the principles of plastic surgery are rebuilding or reconstruction. That's what plastic surgery means. Plastic is the Greek word for plastikos, or to rebuild.
Okay.
So we rebuild any part of the body that's been damaged from scratch. And therefore, we literally operate head to toe, inside and out. No two operations are the same. There's often this belief that plastic surgery and cosmetic surgery are very different. In actual fact, it's the same specialty. With reconstructive surgery, we are rebuilding things that are abnormal. Whereas with cosmetic surgery, we are changing things that are normal. But it's the same procedures, same principles.
Okay, that's good to know. I actually didn't know that there was a difference and you had to, specialize. Okay, what was it about this, your first procedure, that made you go like, Was there something in particular, or it was just like, because like you said, it afforded you the opportunity to just do anything with any male, female. Was that it?
Well, my very first post was at Great Ormond Street.
Okay.
And I was working in the craniofacial unit, looking after children who are born with skulls that are misshapen. And it was fascinating to watch these plastic surgeons, together with neurosurgeons, take the bones of a child apart, rebuild it, resculpt it, put them back, and then watch the change in the facial structure of that child within a matter of hours. I thought that was the coolest thing I'd ever seen.
And you were like, that's for me.
Wow, absolutely. Absolutely.
Okay, I want to ask you, there's a public misconception about plastic surgery, like you said. It's cosmetic enhancement, but I know you were particularly involved, I know we spoke about this a while ago, in skin cancer.
Yes.
So can you tell us about that?
So skin cancer is one subspecialty within plastic surgery. And my interest in skin cancer came about because I did some research in melanoma when I was training. And then because you become an expert in a particular subject, you then end up as a consultant in that field. I still do all the generality of plastic surgery, but I'm an expert when it comes to skin cancer.
Skin cancer. So there's bleaching and there's toning. I mean, we're digressing, but now that you're going into it, skin cancer. I know for me, I would like to say, I know my producer is going to kill me because it wasn't part of the questions, but skin cancer, toning, bleaching, vitamin. I mean, we see a lot of things going on. What's your take on that?
So the problem with bleaching is that a lot of the creams and agents that are being put on the skin can actually cause cancer. They can cause severe burns. We're not really sure what products are going into the making of these creams, and they don't, lighten the skin uniformly. So, you can prescribe creams at various concentrations for lightening the skin, but we use them very, very cautiously in very low doses. The creams that you get on the black market and in markets are unlicensed, they're uncensored, so you don't really know what's in them. If you lighten the skin enough, you damage the surface, you make it weaker so that it doesn't protect you as it should from the harmful rays of the sun, which then long-term puts you at risk of getting a skin cancer.
Skin cancer. So have you, I'm sure you have, but can you tell us, have you seen any, especially, we know it's mainly women of color that go into the bleaching. Caucasians usually want a tan. I want to talk about, because we're Nigerian, I want to talk about, have you seen any or had to deal with any surgery because of bleaching?
So I haven't seen, because my practice is in the UK, we don't see a lot of people bleaching. What I do see a lot of is skin cancer in albinos. And albinism is quite a big thing in Nigeria. And unfortunately for them, because the skin is lighter, doesn't have the same functioning melanin, which is what you're removing when you bleach the skin, they are more likely to get skin cancers.
Oh, wow. Okay. Thank you.
We also see a lot of skin cancers in people with burns. So people who've had lots of burns from whatever reason, have chronic wounds, and years later develop skin cancers in those burns.
Oh, wow. Okay. Medical person here. Okay, I want to ask you, true or false? There's a perception that people that come for beauty and body enhancements, they're insecure or they're unhappy. I know when you meet some of these individuals, men or women, because it's not just women, guys do it too. You have to go through there's a counseling process. So from that, what's your take? Generally, I mean, we're not violating any client confidentiality here, but speaking generally, what's your take? Is it from being insecure or they're unhappy? Because I'm sure there are deeper things.
So as plastic surgeons, we meet all sorts of patients, the majority of whom are coming for cosmetic surgery, have an idea as to how they want to look. There's a part of them that they don't like, that they want to be changed or improved. Our job as plastic surgeons is to decide whether the ask is something that's reasonable. So can I give you, very much so realistic, you manage their expectations. Is this something that I can realistically give you? Do you have the body for it? If there is any doubt, if there are any red flags that I think that you might have body dysmorphia, you're not sure about a certain procedure, or I think you might need some psychological help or counseling, then we refer our patients to clinical psychologists for an assessment. And they will tell us whether someone is of sound mind, completely understands the implications of what they're asking for, and also the living with the outcome of cosmetic surgery. People just think, it's not like ordering something that you can take back if you don't like it. It's not always that way. You're left with scars. You have to be able to manage them and deal with them. So for anyone who we think there might be some sort of psychological issue, we will refer them to a clinical psychologist. If your expectations are unrealistic, I would tell you, I am not the surgeon for you, or I do not think I can give you what it is that you're looking for.
So that's you.
That's me.
Okay. However, we know not all, because we hear of, there's this program, Botched.
Yes.
So my next question, so this is you. What should somebody who wants to get like a body enhancement? We have BBLs, lipos, and all that. For whatever reason, people go into that. What should somebody look for when they want to decide, okay, this is the right plastic surgeon for me? Because you have said you wouldn't advise based on, I don't think I'm like this and I want my nose to be like whatever, or my girls to be.
Yeah.
What should somebody look for? What are the checklist?
Check
Yes.
qualifications first and foremost. Please make sure this person is a doctor. Please make sure that this surgeon is going to be doing all of the operations and not just a small part of it. Check with patients who they've previously treated. Feedback is very important. If you know someone who's had plastic surgery, who did they go and see? Are they very happy with that person? Were there any problems? Client recommendation is quite strong. Are they members of a society of plastic surgeons? So British Association of Plastic Surgery or an Association of Aesthetic Plastic Surgery. Make sure they're qualified.
Okay. You said something. So I don't know about here. Well, maybe here as well, abroad. When I say here, I mean America, England, wherever. People don't usually tell that they've had something done, COVID, X decides to go and do a surgery and come back like, I was working out in the gym. So how do I want to get something done. People are not telling. And there's, on your side as a doctor, a plastic surgeon, there's this doctor-client confidentiality. So how do you marry that? As in, I want to know, but nobody's telling, I was born like this. How?
So there are two camps of patients. You have the patients that don't tell, they don't want anyone to know. And that's okay. That's the way they want to do. And then you have those that are very happy to sing from the rooftops who they've been to. So in the UK, we usually say to our patients, your GP is the best place to start because GPs know which surgeons they send their patients to. They get letters from various surgeons. So they'll have an idea who a plastic surgeon is that they may have heard of from a patient. So start with your GP. Or you can say, okay, I want to have my surgery. I'm thinking of having it at a very specific hospital. Look at their list of plastic surgeons. Go through the website and decide, I like the look of this person. They look nice. And then you can reach out to them and say, look, I'm interested in having X, Y, and Z. What's the process? What does it involve? Some people will have before and after photographs on their website. That's very personal. Again, patient-client confidentiality. Not everybody wants their photographs on the internet for people to look at. I tend to have photographs that I show patients when I have met them because no two patients are the same. No two operations are the same. And there's no point me showing you a picture of this operation when you're going to end up having this operation.
Something totally different.
So I think it all depends on, that sort of vibe you get when you first meet that surgeon. And, ask all the questions, make a list of questions, ask to see photographs in the clinic. And then, the surgeon that says to you, come back for a second visit. I'm going to give you some thinking time. Come back for a second visit. That's the person you want. Not the person who starts trying to bribe you with buy 2 operations, get 1 free, bring a friend and I'll knock down the rate. You don't want that. You don't want to be negotiating because this is your body.
Exactly.
And you want your body to look at its best. So you want a surgeon who's going to respect what they're doing to you, who's going to treat you as a unique individual, not something to be bargained with.
I want to ask you, so this is the UK. I know there was a time you did surgeries in Lagos.
So there was a time where I was consulting. I was coming to Lagos to see patients. And that is something that I would do again. I think it's great to meet patients, to be able to examine them face to face. Patients want to see you. It's great to be able to have a consultation online, but you can't examine a patient online.
Exactly.
You can't look into someone's eyes and
That's
get a
sincerity.
feel.
Yeah.
So I don't mind consulting in Lagos, but the patients have their surgery here in the UK because I have a team that I work with, an anaesthetist, nursing staff. I know the hospital and the wards. I know the equipment that I'm using. I don't have to worry about power, electricity, and I don't have to worry about anyone looking after my wounds or my patients when I have gone.
Yeah.
So all my surgeries take place in the UK.
I remember then we were talking, there was a time you came and I was asking you and you were like, the problem is the aftercare. Aftercare. And that's where most of the time we get it wrong in Nigeria, the aftercare.
It's not just in Nigeria.
Oh.
So there is a huge trend at the moment for patients to have their plastic surgery in countries like Turkey. And it's cheaper. There is no doubt about it.
And they come to pick you up in
They do.
big car.
They do. There are lots of incentives for people to go to Turkey, these plastic surgery holidays. The truth of the matter is, the majority of the operations we do take 2 to 3 weeks to heal, where you need nursing care. It is best done in a facility where you're looked after, not in a hotel room where somebody comes and visits you once a day and you're left to look after your wounds on your own. A lot of the patients will be put on a plane and sent home within the week. And then if there's a problem, you often have to make your own way back to see them. For a lot of patients that live in the UK, they're told, well, your NHS is free. If there's a problem, just go and just pop into A&E and they'll see you. And unfortunately, we don't. If there's a problem, if your breast implant has to come out, we don't put it back in. So you spend all this money, you think you're saving yourself money, but there is no aftercare. Once you've been seen by the nurse and the doctor and discharged to the hospital, the next port is your airport, and then you're gone.
Wow.
Now, there are some people who can afford to stay longer and pay for that one-on-one care, but that's not usually in the fee that you're quoted.
So it's hidden.
I always say penny wise, pound foolish. I think if you want to know that if there's a problem, you can go back, there are no hidden fees, then you want a surgeon who will see you if there's a complication. And that is something that we talk about from the get-go. It's that the fact that there is no operation that's risk-free. Sometimes things go wrong. And you're welcome to come back if there's a problem so we can sort it out.
Risk. I read somewhere that one of the deadliest surgeries is the BBL. Is that true?
It is. It's absolutely true. It's very, very highly regulated here in the UK because it's very easy to inject fat into the wrong place and it goes straight into the bloodstream and you get an embolus. That's what the patients are dying from. And the buttock has a very rich blood supply. So if you're not careful...
Very rich.
Very rich. Very rich. If you inject the fat in the wrong place, it's a death sentence.
Wow.
So it's done by few and it's very, very highly regulated.
When you just said that, I just imagined a blood vessel and then fat. When what's called, when you do a colonic and you see the tube, you just see the fat going.
That's exactly what happens. So the fat bubble gets into the bloodstream and then it's like being on a river, it gets carried. And wherever it lodges is where the problem is. So if it lodges in the lungs, you get a pulmonary embolism. If it lodges in the brain, well, that's like a stroke. So those are big risks for cosmetic surgery. You have to balance that risk very carefully.
Wow. I'm already scared. Okay. Now, I want to talk about mentoring. I know you always find placements for young girls, and I've seen pictures of you doing ward rounds with students and all. How's that going? And I'm sure you derive a lot of joy. I just want you to talk to us.
For me, that is a lifelong mission. That won't change. When I was training, I was the only Black medical student in my year of 200. And I didn't have
200 students.
200 students in the year.
Just the black dot.
That was me.
Oh, wow.
That was my face in that picture. And then as I was training in surgery, there were few women, no Black women. So when I qualified as a plastic surgeon, I was the first Black female plastic surgeon
Sorry.
in the UK.
She's my friend. I know her.
Thank you. Now I'm pleased to say that there are more. I think there are 3 or 4 of us, which is not great.
That is
When
nothing.
you think about how many Asian female plastic surgeons there are, or Caucasian female plastic surgeons, that number is growing. And I always said that I wished I'd had somebody who looked like me to mentor me, to let me know what the ups and downs would be like, to help me along my way. So I believe in the next generation. I believe that the person who is going to be looking after me when I'm old should look like me. I want my daughter to look at me and aspire. It should be no big deal for her to want to be a plastic surgeon because her mum's a plastic surgeon, not because, I don't know any female black plastic surgeons. So I believe that we need to go out there and show the youth what is possible so that they aspire to do better.
Final question. Were there any barriers? Visible barriers to you as a woman, as a black woman, getting into this field?
Absolutely.
Okay.
Absolutely.
Care to share?
Let's just take the black out of it.
Okay.
As a woman, I was
all,
being told that surgery is very competitive, and you're going to want to have babies at some point. And or people would say, plastic surgery, that's very difficult. How are you going to manage with your kids? And so for me, I found that as a challenge. I thought, well, okay, you don't think I'm up to it.
I'm going to show you.
Let me show you that it can be done. For a lot of women, it's very off-putting. And so a lot of women who I mentor will come and say, well, I'm thinking about having kids. I'm worried about a career in surgery. And I say, why are you worried? What's there to be worried about? In fact, in today's, when I look at all my trainees, 2 of my male trainees are part-time because now they have children and they want to spend some time with their babies. Their wives have gone back to work. They want to look after the babies. So it's all come around. What's good for the women is now good for the men. So, those barriers are being shattered on a daily basis. You can have children, you can be married, you can be a woman and have a career in surgery.
Wow. Thank you so much, Joy. So, last note to the girl who wants to aspire.
So the girl that wants to be a surgeon, the truth is you can be anything you want to be if you put your mind to it. You will find that people will put barriers in your way. They are simply a reflection of their inadequacies, not yours. So do not let someone's negative thoughts or expectations affect how you live your life. Be what you want to be.
Wow. Thank you so much, Joy, Dr. Joy Odili, for this. So healing emerges where compassion and medicine intertwine. Last note from me, I just want to say, always be kind because you never know what someone is dealing with. Beauty is not just outside, it's on the inside as well. Be kind to people. Use kind words because you never really know. Don't judge. Thank you so much for joining us. My name is Teresa Onwuka, Creative Director of Needlepoint. Take care. Bye. God bless.
Bye-bye.